Hey everybody, I am Julie Matheny. I am a speech pathologist and an international board certified IBCLC lactation consultant. I like talking about controversial topics on social media. It can be very interesting. So today I get this question a lot. I have not wanted to talk about it, but today I am going to be talking about gardening and breastfeeding. If you say, why is that controversial? I am talking on social media about gardening, specifically weeding. If you don't understand what that is, do a little Google search, or you can ask me. I'll tell you that later, but we will be talking about gardening. Gardening is legal in the state of California and Colorado. If you are not interested in gardening and breastfeeding, no, this conversation may not be for you. I like to talk about controversial topics and educate on best practice, on evidence-based practice and research and literature. And I do get asked this question a lot by people, especially in California, where gardening is legal. So we're going to do kind of a deep dive. And one of the reasons why I'm bringing this up is because LactMed, which is the IBCLC's gold standard resource for breastfeeding and medications, did an update on July 15th, 2024 on this topic. And so I'm like, well, if they're updating their research, if there's new research and information, let's look at the research. If you follow me for a while, you know that I really like educating with non-biased, non-judgmental, evidence-based research and supporting people in their choices. So we're going to talk through what's in the current research and my thoughts on this topic and how I support patients when they ask me about gardening. Okay, so here we go. Here's the basic summary, right? Why would people choose to garden? Well, in the research, it's used for depression and anxiety. It could be used for pain. It can be used for nausea or appetite. It could be used if there's vomiting, and for fun and recreation or for other reasons. Those are actually in order for how most women specifically are gardening. It's a lot of times for depression, anxiety. It could be an alternative to a pharmaceutical. Some may be using it in pregnancy as an alternative to a pharmaceutical. Okay. The active component in that is THC, which is excreted into breast milk in small quantities. It can stay in the milk for a prolonged period of time. So we have researched alcohol in breastfeeding. We've researched caffeine in breastfeeding. We've researched medications. In the new research that's coming out, that main component stays in breast milk for 6 days, up to 6 weeks. So I'll often get asked, if I've been gardening, how long will that stay in my breast milk? How long should I wait until I feed again? Because with alcohol, we can wait a certain amount of time where we can pump and dump. But it works very different when you're gardening. It stays in much longer. And the active components are fat soluble, meaning they can be stored and absorbed in the breast and stay in there for much longer periods of time. It's more slow releasing for days to weeks. It kind of hangs out in the body. So that's one of the differences of that particular activity. Prior concerns with gardening was impact on milk supply, which is always what we have with any kind of thing that we're engaging in, anything that we're consuming in any quantities. And prior concerns were not only milk supply, but also infant concerns. Everything that we consume can have a side effect in the baby. And side effects were thought to be nervous system development issues, infant motor development concerns, as well as sleepiness or poor feeding. Those are still risks. And that LactMed database has now lots of studies because it's been legalized in the US now in several states for many years. We now have more people that were researching and studying this topic. So definitely go check out the research in that. And we're finding that depending on how it's used and all of that kind of stuff, we're seeing differences in outcomes for babies. All right. Now, maternal perception of use does have an impact on breastfeeding. Mothers who perceive that its use is harmful for their babies often discontinue breastfeeding earlier than for those who believe it will do no harm to their babies. And other factors could include having a positive urine test for baby, which could have legal implications. So there is a factor in maternal perception as well as healthcare support. We have had a lot of very judgy healthcare professionals out there that are just giving blanket statements. There are a lot of healthcare professionals that just were not aware of the research, didn't want to look into the research, and giving all kinds of different advice. But those are kind of those perceptions will impact whether or not somebody will continue breastfeeding while choosing to garden. Now, there was a very small study in Turkey when we're talking milk supply that did find that frequent use reported an increase in milk supply. There have also been lots of anecdotal reports from mothers who are gardening that do see an increase in their milk supply. And the research is kind of reflecting that, yes, it could, with frequent use, increase milk supply for some. Now, based on a history of lack of research, healthcare professionals' opinions on acceptability of gardening have been all over the place. They've been very varied. In general, professional guidelines recommend that it should be avoided by all pregnant and nursing mothers. And nursing mothers should be informed of the risks and the adverse effects on infant development from exposure during breastfeeding. So we do know that it can make babies sleepy. It can contribute to poor weight gain. And some of the studies have shown that paternal use as well as maternal use can increase a risk of sudden infant death, just like smoking does. So it's always a risk factor. It should never be participated in around the baby because of secondhand exposure. How I normally typically educate with my patients is it really comes down to how is it being used, why is it being used, what are the alternatives, right? If it's being used for pain, nausea, depression, anxiety, that's a very different discussion that should be held with healthcare professionals for what are alternatives, how much and how often is it being used, and what are the risk benefits to that unique baby. That's a very different discussion that should be done with informed healthcare providers. And I will always refer back to those healthcare providers. When I have a parent that comes to me and says, I need a girls' night out, this is a once in a while, this is not an everyday thing, it's just occasional, that becomes a very different discussion of once, probably not going to do very much, right? Very rare, very occasional use, even per the research, is that most likely it's fine. It's when it becomes frequent all the time in place of that it then becomes a bigger discussion of risk benefit. So I will usually tell my patients where I know their medical history. Now, I am not your IBCLC. I am not your healthcare provider. This is not medical advice to you. This is pros, cons, risks, benefits. When I'm having a private discussion with my patients, I know their health history. I know their goals. I often, because I work with them for many weeks to months, know their lifestyle. And if I have someone that asks me if they can occasionally garden because they are going on a mom's night out, it's usually like, go have fun. Don't sleep with your baby. Make sure you have somebody there that is a safe healthcare provider. Don't co-sleep. Make sure that they have a separate surface. And have something, pumped milk ready for your baby. Again, you can't clear that from milk like you do with alcohol or with caffeine. So it then becomes another discussion of how old is your baby? How frequently are they breastfeeding? Do you have other milk for them? And how often are you engaging in that activity, right? So that is the big, long discussion of the current research. And I will put a link to that research in the description. And big topic. I know I'm probably going to get lots of interesting messages on this topic. That's where everything is right now. If you have more questions, don't hesitate to reach out. You can always email me, lalactation@gmail.com. You can always DM me if you have further questions. And if you would like to schedule a private consultation, you can do that at lalactation.com. Now you know.